Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. CDC's out vaccine chief resigned, saying, quote, "Enough is enough," end quote. Longtime community leader and LGBTQ health director of the CDC's Center for Immunization and Respiratory Diseases, Dr. Dimitri Daskalakis, has resigned, citing irreconcilable ethical and scientific concerns in a resignation post on both Twitter and Instagram, calling out HHS Secretary Robert F. Kennedy Jr. He wrote, quote, "If I am unable to serve in an environment that treats CDC as a fool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health, I find that the views he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people. Enough is enough," end quote. This resignation followed changes to COVID-19 vaccine approval updates from the FDA that made the vaccines almost exclusively available to seniors and those with underlying health conditions. The American Academy of Pediatrics has warned that the move could undermine vaccine confidence and leave children unprotected during the surge of seasonal respiratory illnesses. I think it's very interesting. I think there's a bigger story to be told here, and I'm sure we'll see more and more of this coming out. But on top of his resignation, there have been 4 other very large individuals, doctors that were at the CDC that has resigned. Dr. Susan Maneras, who was the former CDC director, her background of federal government scientist, Maneras was confirmed by the Senate in July 2025 and sworn in as CDC director on July 31st. On her departure, she left the agency less than a month into her role. Her exit followed a shooting at CDC headquarters and increased political pressure from the Trump administration and HHS Secretary Robert F. Kennedy Jr. And then we had Dr. Deborah Howery, who is the chief medical officer. Her background in emergency medicine physician, hourly led efforts on opioid overdose, mental health, and injury prevention. Departure was due to her resign due to proposed budget cuts and misinformation undermining CDC's mission. And the other one, Dr. Daniel Jernigan, Director, National Center for Emergency and Zoonotic Infectious Diseases background, a 30-year CDC veteran and the top flu expert. Jernigan worked on responses to Ebola, Legionnaire's disease, and flu pandemics. His departure was cited the current political climate and restructuring as reasons for stepping down. And then lastly, Dr. Jennifer Layton, Director, Office of Public Health Data, Surveillance, and Technology background. She led CDC's modernization of health data systems, including wastewater surveillance and AI integration. Her departure was noted as resigned amid broader agency restructuring and leadership changes.
This entire government has lost its mind. They have essentially ditched everything that's rational in favor of political propaganda. Anything that doesn't fit their narrative has to be purged, has to be excised. We're going to have a story later about other LGBTQ rights, and essentially what they're trying to say is, if it doesn't fit our warped narrative that horse paste cure COVID, and now they're saying that they will severely restrict the availability of the next false COVID vaccine to just seniors and people with underlying condition. So essentially children are left out in the cold, and other vulnerable people, such as people living with immunocompromised situations like being HIV positive, will be the first to suffer.
But they love children. They don't want babies to be aborted. They love children. Love them. They fucking love children. This ongoing exodus is terrifying on so many levels, especially with the winter and flu season approaching, in addition to yet another COVID strain making the rounds. And it's disgusting and disheartening that ignorant ex-junkie Kennedy is staying put at HHS, and all these experts in the field are fleeing just because Kennedy and that D-list actress he's married to like to play doctor at home doesn't make him qualified to be making health decisions that would be better made for more qualified,
there are worse coming.
intelligent people.
There are worse coming. They are trying to gut regulation of any kind of homeopathic medicine. They're going to let quacks run amok. Expect these people, these highly qualified people, to be replaced by quackpot doctors who are
like
going to be
Kennedy.
who are basically going to sell you snake oil cure.
Drink bleach.
Yeah, inject bleach. Worse.
Well, that is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.